Welcome back. Managing pain and other ailments does not always require a pill bottle. More people are turning to alternative ways to treat sometimes severe and stubborn medical conditions. The so-called father of acupuncture in the military has not only tailored a procedure that's seeing results downrange, he's now training hundreds of other doctors across the services. Petty Officer Michael Wilkin has more.
I might be nervous once I feel the first one, and if it hurts, then maybe I'll be nervous after that.
Staff Sergeant Candace Helder has never tried anything like this before.
I've had a sinus infection for a little bit now, and I've been dizzy for about a month now.
But she is willing to try acupuncture in order to get back in the air ASAP.
Some days I'm not able to necessarily work on the jet, so that's definitely a problem. So I'm just trying to alleviate that so I can get back to doing what I do.
Flight attendants and pilots are just a few of the military personnel whose mission can be hampered by any kind of illness.
There's not a lot we can take where we can still stay on flying status. So the relief was quick and long lasting.
Before acupuncture, Lieutenant Colonel Susan Foy's pain was so severe she couldn't do required physical therapy.
It really got rid of the pain to where I was then able to do the strengthening exercises and stretches and things that I needed to do to prevent it from coming back.
A lot of pilots do not want to be on medicines. They don't want to be grounded for a long period of time. They want to be able to get something done and be done with it and get back to flying. And so we can institute the battlefield acupuncture, and although they will be grounded for as long as those little needles are in the ear, which is usually 2 to 5 days, they will quite frequently get immediate results and not have to take medications. Sometimes we cover people from having medical evaluation boards, being kicked out of the military, because they've been through every other kind of treatment for the disorder, and then the military has no choice really except to board them out. But yet we can give them one more chance. We come here, we can try some treatments, and if we can recover them and resolve their situation, then they're good to go.
The most common type of acupuncture practiced here at Malcolm Grow Medical Clinic is battlefield acupuncture. That's been used in both Iraq and Afghanistan.
I wanted something that was faster, that would be very simple to use.
It was developed by retired Air Force Colonel Richard Nimzow, who's practiced the Eastern method for decades, earning him the moniker, the father of acupuncture.
It's based on the concept that the meridians that run through the body have an energy blockage caused by wind, dampness, heat, and so forth. And by opening up the blockage, possibly you reduce the pain.
In battlefield acupuncture, the needles are placed in the ears, allowing for ease of movement, and for patients to wear them until they fall out on their own for up to 5 days.
How's that? Are you okay?
Yeah, fine.
The needles are also much smaller than those used in traditional acupuncture.
It just feels like a piercing, if you will, getting your ears pierced.
It's a little prick. It doesn't really hurt bad.
It's a kind of like a generic treatment, which means that it's easy to learn.
That's allowed Dr. Nimzow to train hundreds of Navy, Army, as well as Air Force doctors like Colonel Piazza in this ancient Eastern procedure.
The acupuncture can reduce the symptoms enough where traditional medicines, then you can go with lower doses or less medicines, which is great, because that's the goal, is less medicines, less costs associated with that, and less side effects from medicines.
Doctors are quick to note, while it may provide up to 100% relief in patients, acupuncture is not a substitute and is used in conjunction with traditional medicine.
I would frequently do the battlefield acupuncture, but still give them, for example, some Motrin to take with them in case the pain came back.
So instead of all these, Staff Sergeant Helder is walking out without medication and at least one symptom already cleared.
I don't feel the earache as much.
You don't feel the earache as much?
No.
Fantastic. Great. We'll come on.
Petty Officer Michael Wilkin, TPC News.
The next round of training will take place at Camp Lejeune.